Should I turn on the fan or is it gonna be?
No, you'll be good.
Let me know when it's. Yeah, let me know when it's live. You're on Facebook too?
You're good. Good.
All right. Okay. Mic check. Okay. You go to the live video. Just gonna kill a few seconds or minutes. Let a couple of people get on here. All right. Oh yeah. Oh, that's gonna be good. Resources. Okay.
Are you doing the full screen with the speaker or split?
I think like this. Yeah,
Okay.
like this is good because it's a good like back and forth conversation. All right. Let's see. All right. Go ahead and share. I'm gonna share it on my page real quick. You want to share it on the other pages? Okay. And then we're just gonna get into it. People will come in when they come in. Anyways, it's gonna be a great conversation. Okay. Oh, you're mute that. Hello. Okay. All right. So let me know, people that are watching, let me know if you start hearing an echo. Matt, do you hear an echo from me?
I do not hear an echo from you. Do you hear an echo from me?
Nope. All right, let's get into it. Okay, so thank you everyone for tuning in to this month's episode of Voces y Visiones. It's not the only episode, there's a bonus episode actually. This is an episode I'm really excited about. I want to start off by saying thank you to our season sponsors, ACLA, Mayo Clinic, the voters of Minnesota. This is made possible with grants and support from each of these organizations, and we can't be grateful enough to everyone. And thank you all for tuning in. I'm really excited to get into this conversation. So this episode's topic, for anybody who's been keeping up lately, is around mental health. And I know we've covered mental health before, but this is a different angle, a different approach. You know, every conversation we have is with someone different and the different perspective, expertise, and professional field. So before we get into our special guest today, I want to get into the topic and the artwork. So this is the piece that I chose to share for this episode. The reason I chose to share this one is because, for one, let's get into the details about the piece itself. It's about 16 by 24 regular size canvas, acrylic on canvas. There might be some pastel on there or charcoal, but this was actually inspired by one of my trips to my hometown. I was walking the streets by myself, just walking around, and I saw this little kid that was all alone in a diaper, all alone with a dog playing in puddles. And there was like nobody else in sight. And I was thinking to myself, like, wow, that was like crazy to see that. And at the same time, it reminded me of when I was little and I would go and explore by myself. And I would get lost in the alley or, you know, the field right next door. And I don't know if I was that young, but I remember being young and getting lost and going on adventures outside by myself. And one of the things that really stood out to me about that moment and about these memories is how I remember being in my head a lot. I remember my moments of like when I first had like self-realization. I remember the moments where I was in my head using my imagination to like disappear to wonderful places and go on these like journeys in my mind, using the imagination and my like self-reflection to just transport myself to like a really like magical place. So I kind of reference that with this, with the reflection and everything. Now, the black that you see all around there, the darkness and all that, I use that, of course, to represent the traumas and the hardships that this little kid didn't know that they were about to experience throughout their lives. They didn't know, like, in this moment of bliss, they're colorful, they're bright, they're vibrant, but around them is this darkness and this heaviness that they didn't know they were about to endure. So that's why I thought about this piece when I was thinking about this episode, and it's like after you go through the traumas and everything, I found myself wanting to get back to that little kid, wanting to get back to that self-reflection, that kid that was in his head for exciting things, not the one that was in his head for negative, because nowadays we use our imagination for negative sometimes, for a lot of anxiety and depression, and a lot of it, has to do with us, the way that the stories we tell ourselves in our head. And I've always tried to get back to this innocent kid, telling myself wonderful stories and good stories that make me feel good. So like I said, we've done episodes. Oh my God, I just realized I wasn't sharing the screen. Hold on, let me do this. I'm a little rusty, I guess. All right, so real quick. All right, so this is the piece I was talking about. Can you see it on there? Okay, this is the piece I was talking about. The little kid, self-reflecting, covered in darkness, not knowing the traumas they were going to go through and things that they were going to experience, but always trying to find their way back to themselves, back to their inner selves, back to that good inner dialogue, the inner dialogue that's exciting, that's creative, that's encouraging. So yeah, this is the piece, 16 by 24, I believe, acrylic on canvas. Yeah, so that is the piece. My bad, I was tripping. So when I was thinking about trying to find a way to get back to that center, back to that place, of course we've done, like I said, we've done episodes on mental health where we try to unpack things and unpack different avenues and ways to help alleviate PTSD and stuff. But now I want to dive into it even more, because I feel like it's such a robust topic, and I feel like there's a lot more to unpack. So I'm truly excited to welcome our guest today, Mathew. Mathew, how do you pronounce your last name?
It's Bjorngaard. So if you pretend the J is a Y.
Perfect. Mathew Bjorngaard. Mathew is a Rochester native, an entrepreneur, and mental health advocate. Mathew's story is one of stress, anxiety, depression, addiction, failure, and resiliency. He is the founder of Mental Fitness LLC, has served as treasurer for the National Alliance on Mental Illness in Southeast Minnesota, taught classes on self-care and stress management, and has been featured in Authority and Thrive Global magazines. He currently lives in Rochester with his wife and their 2 corgis, and is joining NAMI after a 7-year career in the private sector. Mathew strives to use his knowledge and personal experiences to help others lead healthier and more fulfilling lives. And he's especially excited to continue this mission alongside a storied organization like NAMI Southeast Minnesota. Now, additional info on Mathew's role. As the executive director, Mathew will be responsible for leading the organization to fulfill NAMI Southeast mission of improving mental wellness through listening, advocating, informing, and leading. And here's a quote. Mathew has a tremendous support for NAMI Southeast Minnesota during the last year. He has stepped up time and time again, and I am excited for him to start in his role as executive director. He has a huge passion for mental health and a drive that will be a great asset as NAMI Southeast Minnesota moves into its next chapter. This was Megan Sheridan, the board president. Now, Matthew, once again, thank you so much for joining us. I'm really excited to get into these topics. I want to go back to why our date was changed. So we originally had it planned for, what was it, last week or the week before, right?
2 weeks ago, yep.
Yeah, 2 weeks ago. And it was an hour before showtime. And I was so torn because I remember I was like battling with myself mentally, feeling really bad, like feeling really down, feeling, I was having one of those rough patches mentally. And I was like, look, I could just push through it, not tell anybody what I'm going, just like always, just go through it, right? Push through it. But then it hit me, I'm like, this is something about mental health. And this is real life, in real time. So this idea hit me like, you know what, I think I'm just gonna message him and be completely honest and hope that it goes well and hope that people understand, because I feel like it's more genuine to not just cover like past tense or a wide scope of what my people go through, but what I'm going through too at this moment in time. So that's when I messaged you. I was like, hey, I'm going through it right now. I'd just like to be completely honest. I can't do the show right now tonight. And I waited for your message, and I'm like, oh, I shouldn't have said it. I shouldn't have, oh, maybe he's gonna think like whatever. Like, and then your response changed everything for me. One of the first things, without getting too much into it, one of the first things you said was like, wow, you're like, first of all, give yourself props for knowing like to step back and not just push through this episode, knowing to step back, acknowledging that you're in a rough patch and acknowledging that you need space. And another thing, acknowledging that you told me, you said that's huge. And, you offered help and everything else and said, you know what, just go ahead, take care of you for now, and we'll leave the schedule open. And that was amazing to me. That to me was like, wow, the first time I ever opened up to anybody like about like what I was going through in real time, and your response like really, really helped me. Like it really changed the way I perceive seeking help and stuff like that, talking to people. So thank you for that right off top. So let's get right into it. I want you do you want to go real quick into when you started at NAMI, what you see moving forward, what you're up to right now, and what your roles are and when you started.
Yeah. So, and thank you first and foremost, Bobby, for having me, for really setting the bar high with that bio. But yeah, so just a little bit about me, my background. So, as you mentioned, I'm the executive director for the Southeast Minnesota affiliate of the National Alliance on Mental Illness, or NAMI, as we call it for short. Just quickly, a little bit more about NAMI. NAMI is the nation's largest grassroots mental health organization that, across the country is dedicated to building better lives for people who are affected by mental illness, whether it's those who are suffering from, mental health issues themselves or family members or friends. For me, I've actually been in this role for a little over 3 months now. As you had mentioned, prior to me taking this role, I actually worked in corporate finance at IBM for 7 years. And from an outsider's perspective, that's a very big jump from going from a for-profit company, working in finance, to jumping into the nonprofit world. And, for me, I have to give a little bit more about my mental health journey to really close that gap. And I think this goes back to what really resonated for me in the email that you had sent, Bobby, a couple of weeks ago, right when we pushed off, this episode. So going back, my mental health journey started maybe 6 years ago. That was when I was formally diagnosed with generalized anxiety disorder and persistent depressive disorder. after I finally agreed to get some help. Before that, I had started, exhibiting some symptoms of these, mental health challenges in my early 20s, but I didn't have any mental health education, didn't have any tools in my so-called mental health toolkit. And for me, I spent a good portion of my early 20s just flat out trying to ignore my symptoms, which is the exact opposite of what you did a few weeks ago, which is why I commend you so much. Because for me, it was easy to ignore it, chalk it up to, oh, you know what, maybe everyone feels this way. I just need to deal with it, right? You got to ignore it. You got to push through. The problem for me was that I couldn't ignore it forever. And eventually me attempting to ignore it turned into me utilizing alcohol to cope. I actually abused alcohol for several years. It got to the point where I dropped out of college for a while. I was on probation at work. I had to move back in with my parents, right? And throughout all of this, it was easier for me to ignore the fact that, I had some mental health challenges. And it was actually easier for me to say, oh, no, I have an alcohol issue. That's all it is. Oh, well. But eventually I just physically couldn't ignore it anymore. And for me, finally admitting, out loud, not only that, that I needed some help, but, just letting folks in my support circle know that, it really changed my trajectory. Because I dove into learning more about my own brain, my own skill sets. I wanted to eventually share my own experiences with others so that maybe, other people didn't go through as long of a time frame in their lives, either ignoring it or just not understanding, what's going on with them. Because there's several different ways that, that mental illnesses or mental health challenges can, present themselves. For me specifically, it's because I have a chemical imbalance in my brain. It could be genetics, it could be trauma, right? And that's just on the spectrum of, formal mental illnesses. Everyone suffers from mental health challenges from time to time, whether it is formally diagnosed, mental illnesses or, just the occasional stress, anxiety, depression, that sort of thing. So again, for me, it was really important to learn that I needed to not ignore that. And so that's what eventually led me to NAMI. And where we are at right now, I know this was a very long, winding way to get back to your question, Bobby, but where we're at right now in the first 3 months, one of the biggest focuses for me is getting more mental health education into the school system. For me, like I had mentioned, I had never had any sort of mental health education, either formally or or informally. And I think that there's a big opportunity to at least, give that mental health 101, earlier in life, so folks can ideally start building up some of those mental health, tools in their toolkit, a lot sooner than I did, just as an example.
Oh, that's really great. No, it means that much more when it's coming from a place of experience, especially for anyone on the other side of like who may not know you or anybody in these organizations or in these positions of profession expertise or whatever. One of the first things we always do, especially in my community, trust is a big thing. Us to even open up to someone, we have to trust you or trust that your experience is credible, or like you can even like relate to us in any way, because if not, there's that disconnect. Like I remember they would have people come to our schools and try to talk about staying out of trouble or whatever, and these were people that like never lived like us, were never poor, never really got into trouble, but they like will come and try to like coach us out of our environments. And I'm like, you don't know that I go home after this and I like have to like fight roaches out of my cereal to eat, or I have to like avoid certain area because if not, there's going to be like fights and drama, and like you don't know that like the realities of us, like the things we have to navigate to survive. So there's that disconnect. There's no so right there, we put the walls up. So right now, like us talking about mental health and everything, I think it's really good, like you sharing that part of your story and knowing that you went through that and knowing that you struggled with alcoholism and everything, because I know, like me personally and a lot of people that I love struggle and have struggled with alcoholism, with substance abuse. We've lost so many, like, and I wish I was exaggerating. I really do. I wish I was exaggerating when I say that we've lost so many loved ones due to substance abuse and things like that. It's really, it's unbelievable. Like you would not believe it. Like I feel sometimes like when I share some of that stuff with people up here, people who haven't gone through this, like, similar things, it almost sounds unreal. It sounds so unreal. Like I think it was it last year? I believe it was last year. I lost 6 people alone. You know, me and like my people, like we 6 people alone that were like really close. And these are untimely deaths. These are overdoses. These are, you know, and most of them are really, they were overdoses. And then there was like one that wasn't an overdose, but they were living that life too. So, you know, like they got into an accident or something, but they were in the environment where, you know, addiction was their life. So it's really, really sad. So yeah, thank you for sharing that part of yourself with us. So I want one of the kickoff points to be the NAMI about section. So one of the things that helped me like decide what we were going to talk about, some of the stuff written in the about section. And to people that are tuning in, to everyone who's tuning in, there's a NAMI in Corpus Christi. So everything that we're saying here, and there's free resources that we're going to mention. So everything that we're talking about here, a lot of it, you can access that in Robstown and Corpus and all that. So we'll be sharing links to that stuff and everything. So don't think this is just a conversation for Minnesota. This is super, super accessible down there. So please keep that in mind and keep an eye out for the stuff that we're going to share. So let me get into the about section of NAMI real quick. Some of the stuff stood out. So our mission is to improve mental wellness through listening, advocating, informing, and leading. Our staff and volunteers are comprised of people with mental illness, family members, and professionals. We offer critical education, advocacy, and support programs in the community at no charge to support the individual, their loved ones, and the mental health care system. We do this by working to eliminate the stigma associated with mental illness, encouraging those with mental illness to seek treatment, and advocating policies and practices that encourage the development of equitable, community-based mental health services which empower active recovery. I think that's amazing. And it says, okay, NAMI Southeast Minnesota programs inspire hope that you and your loved ones experience the fullest level of recovery possible. So I think that's amazing. And I want to go down the line and let's start with, so eliminating stigma. How does NAMI go about helping to eliminate stigma? One of the biggest things that stands out to me always is the use of the term mental illness instead of mental health. And I've had friends of mine that have brought that up. Like, I don't like the term like mental illness, or I don't like, because, you know, a lot of people are real sensitive on like what the terminology and what that means. I feel like that's part of the stigma, or that adds to the stigma. So what are some ways you feel are effective in eliminating stigma? What are some things that you do at NAMI to help with that?
Yeah, so I would say that there's really 4 main ways that, you know, at NAMI we try going about, right, eliminating stigma. And when we talk about, you know, eliminating, you know, that means, you know, talking openly, being willing to get help. Because like I mentioned before, everyone is impacted by poor mental health at some point. But unfortunately, many don't talk about it. Folks try to ignore it, right? We already talked about that quite a bit. And, you know, we at NAMI aim to eliminate that, you know, by encouraging that open dialogue and letting others know that they are not alone. Now, how specifically do we go about doing that? Like I said, first and foremost, by having open discussions. So we at NAMI Southeast Minnesota and NAMIs across the country host support groups every week. There are support groups both for individuals living with mental health challenges, and also there are groups for family members and friends of those individuals. In general, these support groups offer a safe space to share ideas, insights, share encouragement. In addition to that, our staff and volunteers, also try and talk openly about our own challenges out in the community. Me being, being able to talk to you right now and having kind of walked through my story openly, right? That's just a little piece of what we can do at NAMI to try and reduce that stigma just by talking about our own experiences. The second big thing that we do is offer direct support. So NAMI, again, across the United States, offers one-on-one peer support services. So this is a supportive relationship between an individual and a certified peer support specialist who has a lived experience with mental illness. The peer support, emphasizes creating and developing tools for your, mental health toolkit to really just help you, continue to move forward in your own, mental health journey. So again, this doesn't necessarily mean, and we'll get to this in a minute, the difference between, mental illness versus mental health, but you don't need to have a formally diagnosed mental illness to benefit from peer support, right? It's just a matter of having someone there, by your side to help you, again, in creating tools, goals, and being able to move forward, in your own mental health journey. The third thing that we do is try to educate. NAMI has a number of top-rated classes and workshops, again, that we try to bring to schools across the country, to workplaces, community events, and just other communities to help provide mental health education, from just very basic, almost like mental health 101, all the way to providing crisis intervention training to police and first responders. And then the fourth piece would be just by simply advocating. NAMI, again, as a whole, works at the state and local levels to improve treatment and improve services for people, with mental illnesses, and also frequently supports, increased funding in mental health research. Now, NAMI Southeast Minnesota, we have not done this as much as some of the larger affiliates, but that's also something that we want to start doing a better job at. But those are really the four big things: having open dialogues, having direct one-on-one support, providing education, and then just simply advocating for mental health.
Yeah, that's really great. Those are like really great pillars to stand on. Now the next thing is encourage. So it's let's see. Okay, advocating policies and practices that encourage the development of equitable community-based health services. So encourage those with mental illness to seek treatment. How do you go about encouraging them to seek treatment? Like, do you wait till they're already there, or is it through outreach? Like, how do you go about encouraging someone to?
Yeah, so first and foremost, you cannot, we at NAMI, we can't help someone who does not want the help, right? Again, it goes back to just ignoring it, right? And accepting it. All we can do, as an organization, is provide the information, the resources, and the support. Not everyone who could benefit from mental health care is maybe immediately ready for it. But what we try to do is just let folks know that we are here whenever they are ready. And again, to let them know that they aren't alone. And in my mind, when we use the word treatment, that can be a lot of different things. That could be, medication, that could be therapy, that could be, again, just peer support or joining support groups or educating yourself. Or it could also be, reaching out to a crisis center or suicide prevention hotline, if you or someone might be in crisis. I would say, looking at the mental health care system as a whole, it can be really confusing and really tough to navigate. So again, for me, I like to keep it simple, at least in my own brain, and try to break it down into 3 broad categories. The first one being prevention. And so that would be different services or resources that are available that help to avoid poor mental health or to improve mental health. And so in prevention, right, that's going to appeal to both folks that have diagnosed mental illnesses or folks that just have occasional stress, anxiety, right, depression, right, just living life as a human. So that is one bucket. The second bucket would be like crisis intervention. So that would be addressing a mental health crisis, any situation where a person's mental health has maybe become so poor or deteriorated so much that their behavior puts them at risk of hurting themselves or others. And then the third category would be, as I call it, postvention. So that would be like services and resources to help facilitate stabilization or recovery after a mental health crisis. And so for NAMI, our wheelhouse is really that prevention and that postvention. That's where we live. And depending on individual circumstances, right, our peer support, our support groups, our education classes, can kind of fit into either of those categories. When it comes to crisis intervention, right, that's where, there are local crisis centers or mobile crisis response teams, or even police and first responders if other resources aren't available in, a person's local area. And, NAMI, we attempt to be kind of that central hub for all mental health resources. And we do work closely, especially in Southeast Minnesota, with our local crisis center. I think I mentioned this before. We provide crisis intervention training, to police and first responders, but we don't provide those crisis intervention services directly. So I guess just to kind of summarize how we help to encourage treatment is we just try to meet people where they're at, right? And again, we can provide, the information and the direction, but at the end of the day, the individual themselves, they also need to, to be aware that they're only going to be able to get help if they want to get help. Does that make sense?
Absolutely. Because having that balance of like reaching out and empowering the self, right?
Exactly.
Because it's actually empowering to reach out for help,
Yep.
It's a weird conundrum, you feel more empowered by reaching out. It's like, wow, I can, it just doesn't all have to sit on me. There's people out here that are here for this and could help me, which I think is really, really powerful. Now, the next thing is encourage to, whoa, hold up. Did I go? Huh?
Got a little blurry.
Yeah, I'm blurry for some reason. What? Hold up.
Or what?
Let me see. 1 second. Technical difficulties. All right. I don't even know what. Hold on. How do you do this? That's literally never happened before. Okay. Problem solved. I'm gonna. Huh? Oh yeah. One sec. I got it right here. Let me. I'm switching the video to. Okay. Cool. All right. Quick problem solve. Oh yeah, and anyone who's tuning in, please feel free to start adding to the conversation in the comment section, and having some questions ready for when we open it up here in a little bit for some Q&A. We're gonna have a really great conversation that we're excited to have you join us on. So yeah, feel free to join in the conversation in the comments and to ask questions. So Marianne Salinas has a question real quick. How can we Oh, okay. All right. So I'm going to ask that as soon as we're done with this conversation part, and that'll be my first question on there. Thanks, Mary, for joining the conversation. So policies and practices that encourage development of equitable community-based mental health services. So what does that mean when NAMI says equitable community-based mental health services? What do you envision? What does that look like? What does that feel like?
Yes. So when we talk about equitable community services, the way that I look at it is, in a lot of pockets around the United States, there are a lot of different resources, that are potentially available, when it comes to mental health. The issues that we frequently run into are that some of those mental health resources, there are barriers to, right? Whether it's a financial barrier or a health insurance barrier, or the other barrier is folks around the community just not even knowing that some of those services exist in the first place. So from NAMI's perspective, we are not out here just trying to promote our own, programs and our own services. We are trying to lift up all of the community services and be able to, provide that, if you want to call it that, variety of pamphlets to say, here is your individual situation, because everyone, has a completely different life scenario. But we like to be able to say, here are all of the options out there. What is going to best fit your scenario? And that's a lot easier said than done, because there is a lack of communication in a lot of times between, different therapist offices or different, mental health facilities, or even the police or our hospitals, right? There's a lot of stuff that is sporadically provided throughout different communities, but we could do a lot better job of, collaborating and bringing those services, more together. So at least from my perspective, that is how I foresee having equitable community resources and services, is not only just having those resources be available, and not just having the community know that those resources are available, but being able to collaborate between the different organizations to ensure that each individual is going down the path that is best for them, again, to reduce or eliminate barriers, again, whether it be financial barriers or insurance barriers, location barriers, whatever it might be.
So reduce, eliminate barriers. Accessibility is like a big thing. I love the way that you're envisioning that collaboration, talking about collaboration and strengthening this network that's in support of the same mission, which is mental health for us as a society, for people. I love the fact that NAMI is leaning more towards streamlining all that stuff and having it in one place, like you said, instead of going here, going there, it's like a central hub for mental health, which I think is really, really important, because I know a lot of my people, when it comes to, okay, you know what, I finally talked myself into, I want to get help. I want to go seek something. Then immediately, by default, we start telling ourselves oh, it's too far. Oh, I don't have insurance. Oh, I don't have it. You start building the barriers in your head that are going to get you to where you can get help. So I love the fact that NAMI's like breaking down those barriers, and then there's a clear path forward. There's more of a bridge straight from you to the help you need and the resources that you need. You know, all you got to do is go to NAMI or call NAMI, and then from there they have this, boom, and you can branch out from there.
Absolutely.
I love that. And
are we perfect? I mean, absolutely not. And it is there's a long road ahead of us, but and I don't mean to cut you off, but you mentioning that, one prime example that happened recently, specifically, at our affiliate, is we recently had someone come in who is now in our peer support program, who prior to coming and reaching out to NAMI had called 14 different organizations looking for some sort of mental health support. And she was turned away either because places didn't have openings or, because of her insurance situation, whatever it might be. But that in and of itself is exhausting. I can't even imagine on a good day having to make 14 phone calls. But
if you're already battling stuff mentally.
Exactly. I was just impressed that this particular person was even able to make 14 phone calls, but she should not have had to have done that.
Yeah.
Right. And and that comes back to NAMI as an organization. We need to do a better job of getting ourselves out there. Before I joined the NAMI board of directors 2 years ago, I had gone my entire life without ever even having heard of NAMI, right? And I've lived in a city where an affiliate has been basically my entire life. So just one example there.
No, and the fact that one of the biggest things that hit me, another like big inspiration for me to really dive deep into mental health and everything and be more open about it was that like my son's a teenager. My son had been struggling. He'd been struggling over these past few years with mental health, with anxiety, with breakdowns, full-on breakdowns where, I had to pick him up from school and stuff. It was that bad. And I felt so helpless and trying to get him into like counseling and things like that. But he's still, he's a teenager, so he's more reserved, not wanting to do that stuff. And he's never seen that through his parents, like seeking professional help. So I couldn't like tell him like, hey, this is what you get from it, because I had never experienced it either. But he went to his first counseling session a couple of weeks back. And I never leave his side in situations like this, because we read, I help him read the person, or I read him as he's like talking to and see if he's comfortable.
Mm-hmm.
When we get there and they're like, okay, see you in 45 minutes. And he's going to be in here by himself. And I looked at him and I was like, you good, buddy? And he's like, I'm good. And, he went in real quiet and just real reserved. And I'm waiting in the hallway for like 45 minutes. And 45 minutes later, I hear him talking from down the hall, like full volume, talking. He's open, he's being, and I'm like, whoa, he came out a completely different person. Because I was like, oh, I hope he likes it. I hope he likes it, because I feel like having access to some kind of therapy or counseling or some kind of professional help is so important. And I wish I would have like had that access or had that resource growing up. So to see him like, be open to it and actually come out a different person, I was like, hey, how was it? And he was like, oh, it was great. Oh, I'm looking forward to the next one. And so like now, that was so huge to me. And I'm like, wow. Then it inspired me. And he sent me a meme because we joke around a lot. And he was like, it was like this futuristic city, like this utopia. And this family's like overlooking flying cars and everything. And it says, what the world would be if parents went to therapy. And I was like laughing, right? And then I was like, man, he has a point. I'm like, I was like, you know what? That pushed me to, I was like, I want to seek stuff too, but I don't have insurance. So then I was like, there's no way. I'm going to have to just, I don't know, thug it out. And then I looked into NAMI and then saw that it was free resources, and that changed everything for me. I'm like, oh my God, what? It's free? And it's down there in Corpus and Robson, like where my people can reach it also. And it's like, oh man, like people need to hear about this, like, and it's that thing, that accessibility, breaking down barriers. So it sounds like y'all have a lot built in, a lot going on, and you're also seeking to improve in various ways. So what are some of the ways that you seek to improve at NAMI, or what are some ways that you'd like to be better? I know last time we had spoken, you had mentioned something about more outreach, you know, within the Latino community. With like, what are some other things that you see that would help get NAMI to a level that you feel is, you know, more ideal?
Yeah, and I don't, you know, I can't necessarily speak for, you know, NAMI on a nationwide perspective.
Yeah, not just you. Yeah.
But specifically with NAMI Southeast Minnesota, I do think we have done a very poor job of being as inclusive as we could be. From my perspective, our services, while I mean they're absolutely for everyone, it is very much more tailored towards, you know, native English speaking Americans, you know, for lack of better terms. We don't have enough resources or services for the, you know, the limited English proficiency community, for the, you know, for the Latinx community. We don't, at least in, you know, NAMI Southeast Minnesota right now, we don't have Spanish speaking support groups, right? So that in and of itself right there is going to be a barrier for a lot of people. And to me, that's just not even close to good enough. So, you know, that's definitely one thing that I can do a better job of, that NAMI Southeast Minnesota can do a better job of. I would argue, you know, NAMI from a entirety perspective can do a better job of. But I will say, you know, the audience that is watching, you know, this right now or watching it down the road, you can get involved and have a very direct help to, you know, developing, you know, versions of NAMI's services that are tailored towards, you know, the different communities around the country. You know, we are always looking for folks who maybe want to become support group facilitators, or, you know, want to be able to facilitate, you know, education workshops, folks that just are you know, a mental health advocate to help promote mental health in your own community, or just being on the lookout, you know, for opportunities to bring a, you know, a larger mental health presence. You know, so it's certainly something that, right, we're a community-based organization, and it's, you know, up to us to, you know, engage the community in doing a better job of building, you know, our services infrastructure for, you know, again, not just the, you know, English first speaking community.
Yeah, no, I think that's really, really great. And I think you coming on our show is a really big step in that direction. And I thank you again for your time, you know, and your story. So I'm gonna get into the questions now. We have a couple of questions already. Like I said, this is your time. This is your chance. I mean, we build these conversations so that people can tune in real time, ask questions, and you have these opportunities to this is your moment to ask these questions. So please feel free to add to this conversation. If you have any questions about what NAMI is, what NAMI does, what's doable, what's anything, just please add to this conversation if you want to. This is your chance. So I'm going to start off with Marianne Salinas. Mary asks, how can we get facilities within arm's reach? For instance, Robstown doesn't have any kind of meetings, to say the least. Hold on. Okay. Yep. So Mary, that's one of the things that we're going to be sharing after this also. There's actually a NAMI in Corpus, and they have free programs. They have free classes. They have the support groups. So can you, and I know this is for Minnesota, but I think on the website of the Corpus NAMI, they have similar things. Can you list off a few of the things that NAMI provides? Like, So I know we went through it a little bit earlier. So there's programs, support groups, right? Support
Yep.
groups for individuals and the loved ones. And
Yep.
those are separate support groups, right?
Yep.
So you have
Yep.
a support group for the people going through mental illness. And then for the support group, so the people, the family and the loved ones that live with them or support them in any way, you have those support groups. You have direct support one-on-one that helps you create tools and build like a kit for mental health.
Yep.
You have classes, or is that how you educate? How do you educate? Like classes, seminars?
Yep. So yeah. So, and again, that's going to differ depending on the affiliate. But yes, there's also classes that can be done right within schools or at workplaces, or even, you know, at a smaller level, customized education. Again, it's going to differ from affiliate to affiliate, but yeah, that's another thing. And then I think the other big thing again is just ideally each NAMI affiliate is going to have a wide array of different resources from that area that aren't, you know, specific to NAMI.
I know they have like down there, they have like monthly speakers also.
Yeah, absolutely. And I guess just to quickly touch on, did you say it was Maria?
It's Mary.
On Mary Ann's question, if there is not, you know, a support group or some form of NAMI, you know, presence near you, because that is a barrier, right? Locations of support groups. There, I would say just off the top of my head, there's two different things you could do. Number one, there are a lot of virtual support groups across the country, and you don't have to live in any particular area to join a virtual support group. We at, you know, NAMI Southeast Minnesota, we have both a family and friends virtual support group. We also have, you know, an individuals, you know, with mental health challenges virtual support groups. And we have folks from California that join once in a while, from Michigan that join once in a while.
Is it on video or like this, like Zoom?
Yep. So yeah, so at least with our affiliate, we have both in-person support groups. We also have virtual. So I would say, and this is something that we were going to get to anyway. If you want to, you know, seek out, you know, the NAMI affiliate maybe closest to you, you can go to NAMI.org/find support. So NAMI.org/find support. And you can search the over, I don't know, 600 NAMI affiliates based on zip code. And so you can find the one that's closest to you and see if maybe there is, you know, support groups that exist a little bit closer. If there aren't, reach out to that affiliate and let them know that you would like, you know, the opportunity to have a support group be closer, and you could be, you know, become, you know, more involved in building that support group, you know, in an area that's closer to you as well. So those would be kind of the two things that I would suggest. You know, there's plenty of virtual support groups around the country if there isn't one close to you. Otherwise, yeah, search for your closest affiliate and, you know, reach out to them.
Comments. Yeah, we're actually going to post that in the comments for anybody that's wondering, the NAMI.support group search. So anybody that wants to click on that. Yeah, and then Mary Ann had followed up, said bad experiences with trying to get help, had to go really far to get help. Yeah, again, Mary, this is right there in Corpus, and like Matthew was saying, you can do it online if you want to do it virtually. Are there phone numbers to call? Is there like a phone number maybe, or like how do you deal with someone, like say is that more like the crisis center that would call in, like if someone's looking for somebody to talk to? Or
yeah, so I mean, there's a couple different ways that you can go about that. You could just dial 988. That is now a nationwide number that is, you know, specific to help folks find mental health resources in their area. You don't necessarily have to be, you know, in crisis for that. So that would be a very simple number to call and, you know, find resources that are closer. Otherwise, you know, if we go back to, you know, the NAMI affiliate specifically, if you find a NAMI affiliate in your area, generally, you know, all the affiliates have their own, individual phone numbers, and you could call them too, right? And get more information as well. So those are the kind of the two routes that you can go.
Perfect. And then Erica Wells, it's more of a comment than a question on this one. Erica says, Danny, who was actually a really good friend of mine, who passed away recently, who sadly took his own life. But Danny went to many therapists, psychologists, priests, reached out to professors, and he was turned away or looked at as mental. People don't know how to help intense mental health. He felt judged, and I wish Danny or I found these resources sooner. So great to know y'all are out there. Thank you for this live stream. And then thank you for that comment, Erica. And definitely thinking about Troll during this episode. Then we have another one from my mom. I was gonna call her Gracie, but she'll whoop me after this episode's done. So my mom says when somebody needs help and they can't help themselves, what resources do family have to get them help? So when someone needs help and they can help themselves, what resources do families have to get them help? Is that possible if that person's not in the state?
Yep. Yeah. So I would argue that, family and friends, right? If you are seeing, one of your family members or one of your friends, going through a mental health crisis, or, need some help, or, if you as the family member, if you are feeling stressed, right? If you want some support for yourself, you could basically go down a similar path to someone, who had the mental health challenge. So you can certainly call 988, right? Again, that's the national number. That's not NAMI specific, and they will be able to, walk you through some local resources. Otherwise, NAMI, again, we in and of ourselves have resources for family members and friends. We have support groups for family members and friends, right? Now that is tailored towards you as the family member, your mental health.
Mm-hmm.
But we can also, walk you through, potential ways to help the, individual in your life, get help as well. And again, that's going to vary slightly depending on, on the community that you're in.
So here they would call in, like here, if they were looking for that kind of help, how would they go about it? They would call you, like they would call this office?
Yeah, you can certainly call, any of the NAMI affiliates. Every NAMI affiliate is going to have resources, or should have resources for the family members, not only for their own mental wellness, but also, to be able to give tips or resources for how to get, their family member or their friend the help that they need as well.
Okay, so then question from Erica says, do y'all provide support for families dealing with suicide loss?
Absolutely. So again, this is going to differ slightly, from affiliate to affiliate, but our family support groups would be a good fit. And there are some affiliates out there, and I don't know which ones off the top of my head, but have support groups that are specific to folks that are, coping with, a suicide, in their family, or, within their circle. So that'd be another instance of, find the local NAMI affiliate in your area and see what, support groups that they offer. Otherwise, again, I keep talking about the support groups, but me, just as an example, I'm not good about like being able to talk in a group, that kind of thing. That's where, one-on-one, peer support comes into play. That is not just for the individuals dealing with a mental health challenge.
Oh, it's for the families and friends.
That can absolutely be for the families as well. Now, some NAMI affiliates don't necessarily have like a separate program, but there are different trainings and certifications that our peer support specialists have to go through to, make them certified specifically as a family, support specialist as well. So,
So
that
then-
is also an option. You're not just stuck with, with support groups necessarily, especially if you're, more comfortable in either a one-on-one setting, or if you and some of your family members, want to have like your own dedicated time to talk with a professional, that is also absolutely an option.
So, so then when you call somewhere and you're looking for some help and you're looking for that kind of support, NAMI has a way of, whether it's with a group or speaking one-on-one, about putting you, like, say, like it's just with people that are dealing with suicide loss, just with people that are dealing with like somebody in recovery or with substance, or just, is it like tailored that way or more specific? Are there groups like that or people that speak specifically to those things?
Yes, absolutely. There are, and again, different affiliates are going to have different versions of this, but there are support groups out there that are called, dual diagnosis support groups. So that's somebody that is maybe dealing with a mental health challenge while also, having, substance abuse issues. So, that is a support group that exists. There are also support groups that are specific to parents, and even more specific to parents who maybe have teenagers or young children who are dealing with, mental health challenges, right? So those exist as well. Now, they're not going to exist in every NAMI affiliate, but in most cases, even if your local affiliate doesn't have that specifically, there's probably either a virtual option out there, or still reach out to your local affiliate, and maybe they are looking at starting one of those support groups. That's something that we at NAMI Southeast Minnesota don't have right now, is a parent support group. But that's something we actually are planning on getting started in the fall, because there's been a lot of interest in that. And we're getting help from members of the community to make that a reality. So just because you don't maybe see it on someone's website or whatever it might be, doesn't mean it can't exist ever.
I love that. I love that openness to like organic growth based on community needs, especially with something like this. So Karen asks, what can we as a community do, Rochester, do to increase the number of providers who serve teens?
So that is a good question. So that's going to go back to the advocacy perspective, because in a lot of cases, the barriers to providers, providing help to, younger individuals, is due to laws that are in place or limitations when it comes to licensing. Certain places, and I'll just use, there is a crisis center in Rochester, Minnesota, that has a residential section, right, where individuals can stay for up to 10 days. There is no limit on the number of adults that they can have at any one point in time, but there is a limit not only on the number of youth that they are allowed to have, but also the age with which, because so in that case, it's only ages 10 and up, right? So if you have a child that's under 10, right, that crisis center is basically out as a resource for you right now. And that all goes back to, where we are from a legal perspective. So getting involved with, your local NAMI organization. If you're in Rochester, Minnesota, like me, our state affiliate, they almost exclusively do nothing but advocate and work with our legislature and try to promote, again, an improvement in services and resources. So,
where are they based?
So they are located they're up in the Twin Cities.
St. Paul?
Yeah, it's between Minneapolis and St. Paul. It's one of the two.
State of Vermont. So then teens, crisis center. So then it's like there's legal stuff in the way, and then there's so do you have support groups for teens at NAMI, or do you have any of the resources that are mentioned at NAMI provided for teens, or
So
do you direct them somewhere? or
Yep.
any?
So you will see some of that. That is something that NAMI Southeast Minnesota doesn't have at the moment. But in addition to, that parent support group that I had mentioned, we're trying to start in the fall, being able to provide more specific support on our end, right, from a NAMI perspective to youth and teens. That's another thing that we're attempting to do. There's actually a high school in town here that has basically a teen peer support program that they have within their high school, and I'm actually trying to work with them to give our understanding of how they started their program, because those things do exist, and your local NAMI affiliate will probably know if there is one in the area and where you can get more information on that. But yeah, again, that is a big gap still from in the mental health care system, is having the resources out there for for anyone who's under age 18, for example.
Thank you. That's really, really great. The fact that there's things in motion. For anybody who doesn't know, in the comments section, we're posting, and thank you, Jess, also for adding one of these links. There's a link to the NAMI in Corpus. There's a link to resources for groups for parents, children. There's a crisis response, the Crisis Response Center of Southeast Minnesota. So there's some really great links. If you look in the comment section, there's some stuff that we mentioned there too. Let's see. So Mary Ann, I've walked in Corpus and have walked by meetings, and I could tell by the way people hang around outside with their cigarettes. And I walked in my hometown, Robstown, with not a meeting inside. I've lost so many family and friends to addiction, and I just mean more along the lines of, even with the meetings, could make small but wonderful changes. So Marianne has a really good point. So when we're referring to, like, let's say the people, like my people down in Texas, Corpus Christi, there's Corpus Christi and there's Robstown, and Robstown is right on the outskirts. I mean, you can reach it through city bus, things like that. Really, you could reach it. It's like 5 minutes away, depending on what side you go. It's really close by, but kind of far away if you don't have the resources to travel or to whatever. But it's close enough to where, you get in a car, you'll be there in like 15 minutes, 10 minutes, whatever. Does NAMI, or at least like over here, let's say, does NAMI ever do visiting, like visits to places, or traveling resources, or like a pop-up like situation?
Remote
Yeah,
events.
yeah, like a remote situation, like say, hey, we're gonna go visit this area, or this well, here it would be just like this neighborhood, this area, or whatever, and have like some kind of situation where, like, hey, we're here, boom. Do y'all ever do like that kind of outreach?
Yes. So there are a couple of different ways that we do that. So with our one-on-one peer support, our certified peer support specialists they rarely have, those meetings in the office here. Right. They're out in the community. They can, meet you for coffee, or just go to,
Oh, wow.
go to a park, right? Go for a walk, right? That kind of thing. And I would argue that is going to be the case, around the country. So just because, again, support groups typically are held in, one specific location. Now, for NAMI Southeast Minnesota, we have different in-person support groups in different locations. But again, that doesn't necessarily mean it's going to be, within the distance that you're able to make it. So that's where, again, one-on-one peer support might come into play, because there is more flexibility in terms of where to meet. And then we also do have occasional, kind of, again, pop-up events. I think that's how you put it, pop-up events in the community, where we say, hey, we're gonna, one of our peer support specialists, or one of our, support group facilitators is going to be at, this coffee shop for the next, on Tuesday from 10 to 11 or whatever. So, go and, have a cup of coffee and just chat. So those things aren't necessarily widely advertised, but I guarantee you a lot of the NAMI affiliates are going to have some of those pop-up things. It's just a matter of, asking them.
And would they be like, say, like you here, would you be open to, let me double check that there's any other questions real quick. Okay, yeah, so we'll, So would they be open, or you be open to, let's say there isn't one planned in the near future or on the calendar for the next X amount of time? Are you ever open for someone to approach you and be like, hey, can you come and visit on this date? And like, are y'all open to like working out things like that, even if it's not on the schedule? Like, hey, invitations to locations or organizations or whatever.
Oh, 100%. Absolutely. Yeah.
Nice.
Yeah, absolutely. I mean, again, I can't speak for every affiliate, but I mean, our whole intent is just to be out in the community and, help bring awareness. And so if somebody, wants us to go to, right, a particular location or just be somewhere out in the community, go to an event that's already happening, yeah, we will absolutely do that.
And do y'all, does it necessarily have to be something that's centered around just like mental health or community health, or like, are y'all open to, like, let's say like I have an idea I'm doing this art workshop with at-risk youth. Would y'all like to join me for, the last day of the workshop or whatever, and come and offer, like, give a presentation, talk about resources and things? Would y'all be
100%.
open to like that, like out of the box type? Okay.
Oh, absolutely. Because yes, our bread and butter is mental health, but there are a lot of things that aren't necessarily mental health specific that are still impacted by mental health. And and personally, right, finding things that you enjoy, right, whether it's art, whether it's doing crafts, whether it's music, right, those are all things that are there to help improve mental health. And so while that is not maybe mental health centric, that is certainly, something that we would gladly be a part of.
I love that. It's just like more and more possibilities. Okay, so I have another question. What if the family member doesn't want to get help? Can you, or should I say, is a resources that would help them help themselves? So yeah, so I think this will go back to the question from earlier. If there's a family member that doesn't want to get help, should I say there's resources? Should I direct them to resources or that help them help themselves, or is this better like if they were to call in and have like a good like breakdown of how to handle this,
Yeah. So, and every situation is going to be different. So I would urge that person to, reach out to your local NAMI affiliate and, walk through the situation, and they'll be able to give you, tips. I don't want to just kind of give like a generic, hey, here's the steps that you could maybe go through. I would suggest reach out to your local NAMI affiliate, kind of fill them in on the backstory, and they'll be able to point you in the right direction. Whether it is encouraging that person to get help, or or what it might be.
All right, so this is the last. We've gotten over a little bit. That's how we're having a great conversation. So I'm gonna ask the last couple of questions. So this is your last chance. Everyone who's on here, anybody who's engaged, this is the time to do it. So I don't know if this is a question or no. I believe Mary just had a comment. Yes, my thing is people want to change and say yes, but then don't because the support or some is not there, and the trip to get help versus the next fixed, really. Then the mental illness on top of addiction outweighs going for help. So then, so there's a lot of situations, especially where I'm from, where the distance to go score the next fix to NAMI is like way, NAMI's a world away compared to access to that. So, but Mary brought up a good topic that I wanted to talk about. When it comes to, because I feel like these things, of course, go hand in hand, especially going back to your story too, substance abuse, alcoholism, that and mental health. Okay, say someone is struggling with both or trying to figure out which came first, the chicken or the egg, right? Mm-hmm. And it's like, does NAMI have an avenue for those people that are, struggling? Like, do you decide, do they go in, do you talk to them first and be like, hey, well, you need to address your substance abuse first, so you go this way, or let's help you address the mental health first and then go from there? How do you go about that?
Yeah, and I would argue that that is something that you would work on in tandem. At least in my experience, it was something that I worked on in tandem.
Side by side.
And what was that?
Side by side.
Yeah, side by side, exactly. And so for NAMI, we do offer, I think I mentioned this before, support from a quote unquote dual diagnosis perspective, where you're both struggling with mental health challenges and you're also struggling with substance abuse. So we have certified peer support specialists that have that additional certification to kind of help you walk through that. But we also don't pretend to be everything to everyone. And there are definitely going to be situations where we as NAMI say, hey, we can help you on your mental health journey, but here's this other organization who all they do is help people with their substance abuse issues. So I would recommend that you then also work with them on that, or we can have a joint meeting, right, between the two different organizations, because at the end of the day, we're all on the same team here. We're all just trying to help one another. But we also, I also know that we're not experts in everything either. So there are going to be situations where we suggest, hey, here's a different resource, that's not necessarily mental health specific, that maybe is, whether it's, alcohol specific or drug specific, or, just general substance abuse. There are organizations that is their expertise. And so we can bring them in to the conversation as well.
Nice. Thank you so much for that. So before we log out, before we end with the final closing, I think we wanted to real quick open up, see if anybody we had spoken about trying to get some feedback from the community, because like a lot of people tuning in from the Latin community. So one of the things Mathew wanted to know from NAMI is get feedback from us, from our people, from our community, is what can we do? What can NAMI do to better reach us as a community? What are some ideas to better reach our communities? Do you think bilingual classes, presentations, Minnesota too, especially also Minnesota? What are some ideas that you think would better reach our community? Because I know Marianne had that good point with transportation, things like that. What about bilingual? What are some other ideas? Does anybody have ideas that would better suit our community, and that NAMI could take these notes and try to apply them to their programming and what else, everything else that they do? So please feel free to add those in the comments. And even after this video is done too, we'll get all the comments and feedback together. What are some ideas that you think would better reach our community? Also, volunteers. I think you had mentioned volunteers, right, Matt? Maybe some volunteers moving forward, like if you come up with a bilingual program or a program that support groups that are just for like Latin people in the Latin community, or I think you mentioned volunteers, right? What kind of volunteers would you be open to?
Yep. So I would argue, and this is not just NAMI Southeast Minnesota. This is going to be every affiliate across the country. Our ability to make an impact on our individual communities is directly correlated with the volunteer support and just community support that we have. So specifically for NAMI Southeast Minnesota, the types of volunteers that we're always looking for would be support group facilitators, or if you want to become a volunteer peer supporter. So this would be, someone, you're not at the level of a certified peer support specialist, but where you are maybe willing to, work with an individual to help them, create goals, on their own mental health journey. And these are all things that, that you would go through, a training on. If you have ever been interested in, teaching mental health education workshops or classes, you can certainly do that through NAMI, or just, getting involved in terms of volunteering at events, or I know a lot of NAMI affiliates, are looking for help, in the office, just doing like some office work, that kind of thing. And then also specific to NAMI Southeast Minnesota, we're actually in the early phases of creating an advisory committee, I guess, if you want to call it, which the goal would be, it's made up of individuals from a number of communities within Southeast Minnesota to help provide ideas, inputs, and again, help push for, more inclusive services. So, we'll be looking for representatives from the LGBTQ plus community, from the BIPOC community, folks with, different mental illnesses, folks, with from the neurodiversity community, folks from the Latin community, right? We want to have folks from different communities to have a voice to help lead the direction that NAMI goes in. So again, that's something that's more specific that we're working on in NAMI Southeast Minnesota. But I would argue there's probably similar things going on, across the other affiliates as well.
Oh yeah, thank you. I'm so excited. So I want to leave it on this. Again, we started this episode with me having my own episodes and issues that I've been dealing with. So two things. I got two things. One, would you be open to like a visiting art, like me as a visiting artist / artist talk, and using art as therapy, or art and mental health, things like that? Maybe some kind of workshop around art and mental health. I've done that before. I just did that recently, and I've done that with some at-risk youth, and then I did that with recently with Center Clinic out at Dodge Center. So like
Okay.
art and mental health workshop, I think that would be really good for us to explore maybe. Also, me personally, I think this is the perfect opportunity to actually go and visit NAMI and dive into more of what you have over there and document, what I can like technically or legally document about my journey with NAMI, and share that here at Voces y Visiones. So it's more of like an on the road. It'll be our first, and we've been wanting to do this, but I feel like this is the perfect time. On the road, on location, documentary style, vlog style. I don't know about campaign, but like go to NAMI, go through some programs, go through some stuff, and like document it all.
Yeah.
Would that be cool?
Yeah, I mean, absolutely. Yeah, let's work out the details on that. Yeah, I think that sounds like a great idea.
Let's do it. I think we got a lot of stuff to come up with after this. This was such a great conversation. Thank you so much. Is there anything else you want to say? Anything else we missed?
I would say so there's one thing that we had started to touch on, and then I completely forgot to kind of wrap it up. But talking about the difference between mental illness and mental health or mental wellness, would you want to take 30 seconds to just kind of go through that?
Yeah, let's do it.
Okay. Because I do think it's important to talk about the differences, not only from a terminology perspective, but also I think you mentioned before that, some people just because of that stigma aren't comfortable saying the word mental illness.
Yeah. And especially if they see it as like, if they associate like illness with weakness.
Yep.
Things like that. But yeah, go ahead.
So when we talk about mental health, that just generally refers to our own mental well-being, right? And this applies to everyone. It's our ability to cope with the normal stressors and being able to live a fulfilling, satisfying life while just dealing with everyday challenges, as a human. Right. So, and we all have periods of feeling stressed or feeling depressed, but that does not necessarily mean that we all have a diagnosable mental illness. So when we talk about mental illness, this is a diagnosable disorder within a certain set of criteria. And this is something that can be caused by a number of factors. I think I mentioned this before. It can be caused by genetics. It could be caused by brain chemistry, like in my case. It could be caused by trauma. And really, mental illness just complicates a person's mental health. because it, affects the way that a person feels, thinks, acts, maybe experiences the world. So, just to kind of summarize, mental health impacts everyone, while only some of us are going to experience a diagnosed mental illness. And I think it's helpful to also realize that mental illness does not always lead to poor mental health, and poor mental health is not always due to mental illness. Right? Life events and other outside factors, can affect any of our mental health, whether we have a mental illness or not. The last thing that I will say is, regardless of the differences, personally, I would argue that a lot of the kind of basic skills, the basic tools that you can put in your mental health toolkit are going to be similar, whether we're just talking about your own mental health or even treating, a mental illness. Things like getting exercise and eating well, finding things you enjoy, right? Bobby, in your case, with art and painting, things like that. Maybe even using relaxation techniques or seeking counseling. I may be biased, but I think everyone on the planet could benefit from some form of counseling. And this kind of goes back to you talking about your son before, right? Whether it is therapy or just peer support. I just think it's nice to have, to be able to have kind of that objective third party to run your own concerns or ideas off of, someone that can maybe offer, strategies for promoting, stronger mental health. And again, a lot of people don't seek out some of these things because barriers exist. And that's one thing that NAMI tries to, we're trying to tear down some of those barriers by offering, everything that we do to everyone, regardless of your financial and insurance situation. But yeah, that's just kind of the quick, overview of, mental health versus mental illness. And,
you started with that, huh?
Was that?
I was like, oh, as we were talking about, I was like, that sounds like something we should have started.
Instead we wrapped it up. So we wrapped up with it. So
no, but I think it's really great, and like going back to what you said about my son and then him sending me that meme. Yep. It was like, it inspired me. Like I laughed, but then I was like inspired by it. Like, what if he genuinely thinks like that too? Because he's real smart and emotionally intelligent. And I was like, I've always wanted to be an inspiration to him. I always want to be an inspiration to him in various ways. And I'm like, what if I can be an inspiration to him also? And I tell him he's an inspiration to me by seeking counseling and going and being down with it and everything.
Yeah.
But I'm like, what if I'm an inspiration to him too? And we do this side by side. And I show him, look, I'm taking those same steps also, and I feel like a lot of times, especially in our culture, in our community, our previous generations, for various reasons, for like just having to work, having to make a way for us new generations, having to just like, head down, you work, whatever, just make a living for us. A lot of them, most of them didn't have an opportunity to go seek mental health, or also it was like that. It was frowned upon, and these stigmas carry on to the next generation. So I feel like nowadays it's in a way up to us, not completely up to us, like that burden, but us getting help and us speaking openly about seeking help.
Absolutely.
Not only inspires the future generations that it can be the norm to seek help and to be open and to use these resources, but it's also teaching the generations before us that you can heal, you can start to heal, even like they're older than us and whatever, but we can also teach them now that it's okay to start healing. It's okay to start being open about these things. And I feel like that would make for a much greater present and future,
Yeah. And it goes back to something that I struggled with for a long time. And that is understanding that you don't have to do everything alone, right? It is okay to ask for help, to get help. That's something that, like I said, personally, I struggled with for a long time, but, trying to change my ways.
It's all we can do. Be a little bit better than yesterday.
Exactly.
So thank you so much. Oh my God. I'm so glad that we it happened as organically as it happened, and it's happened today. It feels amazing. And sorry about my alarm. Thank you for all your time. I look forward to following up and going to NAMI and sharing resources. Yeah, so thank you everybody who tuned in. This is episode, I don't know about numbering it, but it's a bonus episode with NAMI with Mathew. Thank you again, and I look forward to talking to you again real soon. Thank you to our sponsors. Thank you for tuning in. We'll talk real soon.
Thanks, Bobby. Thank you, everybody.
Yep. 1 second. Let me